How to prevent hair loss due to Ozempic, Wegovy, Rybelsus and Mounjaro. I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician. So I'm going to discuss about what's the prevalence of hair loss in people taking Ozempic, Wegovy, Rybelsus and Mounjaro. And then why do people suffer from hair loss and what exactly is the mechanism of hair loss? The third subtopic is what's normal hair growth cycle? The fourth subtitle would be what are the treatment options for hair loss? And finally, how to prevent hair loss. Well, a lot of people, a lot of my patients go on to Wegovy or Mounjaro and they do lose weight. As you know, these drugs are very effective. But then some of them have complications and hair loss is one of them. It's not a trivial complication. And some of my patients have significant hair loss, so much so that it affects their self-esteem and confidence. And then they forget about weight loss and they start to seek help for hair loss because it becomes so important. And it affects them psychologically. So that's what I'm going to talk to you about. I'm going to show some evidence. And as I said, I'll be discussing about these 5 main topics. So the first one is what's the prevalence of hair loss with GLP-1 receptor agonists? So Ozempic, Wegovy, Rybelsus and Mounjaro, they're all GLP-1 receptor agonists. And as you know, Mounjaro, which is tirzepatide, which is a combination of GLP and GIP. And so it's a bit more effective. Okay, so what's the prevalence? So for Wegovy, based on the Journal of American Academy of Dermatology, there was an article published with the title Semaglutide and Hair Loss, a real-world analysis published in 2024. So what do you mean by real world? Real world is not research. So a trial goes on or the data is collected after people start to use the medication after the research. So there's no one monitoring them very closely like in a research. So that's called real world. So in this particular real world analysis, they found that people on semaglutide of 2.4 milligram weekly had a 3% weight hair loss compared to placebo. So that's quite significant. So placebo is when they are not on the active medication, that means they were not on Wegovy. So they had 1% weight loss. So there was 3 times more weight loss in people on Wegovy. Now coming to Ozempic, which is a medication for diabetes, it also contains semaglutide like Wegovy. But the dose recommended for diabetes management, the top dose is only 1 milligram. So the real world suggests that again, the prevalence of hair loss in people taking Ozempic was between 3 to 5%. But most studies showed that there was a lower prevalence and that could be because the dose of semaglutide was less. Now, what about Rybelsus? So Rybelsus is oral semaglutide. This is one of the very first peptides being used for any illness and specifically for weight management. So because it's an oral tablet, the absorption was not as good. So the prevalence of hair loss in people taking Rybelsus is less, but there's very limited specific data. Now coming back to Mounjaro, as you know that Mounjaro is more effective than Wegovy, a lot of trials have shown. There was a 5% weight loss with 5 milligram Mounjaro. As you know, 2.5 milligram Mounjaro is the lowest dose, 15 milligram is the highest dose. So with the highest dose of Mounjaro, there was a 5.7% hair loss. So that means there was 5 times more hair loss than the placebo group, which is quite significant. So as you can clearly see that people who lost more weight, there was increased hair loss. People who were on higher dose, there was more hair loss. So that's what you could deduce from what I've just mentioned. Now coming back to what's exactly the mechanism? Why should people lose hair? So the primary mechanism is called telogen effluvium. It's mouthful. Well, I'm going to break it down. I'm going to simplify it. Let's call it just telogen. So it's a common type of hair loss associated with this class of medication, and that's telogen. So it's characterized by this rapid weight loss stress. So whenever there is rapid weight loss stress, the hair gets into this telogen phase. So telogen phase is the resting phase of hair. So I'll talk to you in more detail when I'm discussing about a normal hair growth cycle. So what I just mentioned is whenever there's rapid weight loss, it's a significant stress to the body. So let's say there's a 15% weight loss. That's a huge stress to the body. Because the body starts to think something is going wrong and suddenly I'm not getting the nutrition. So it starts to divert all the nutrition towards the vital organs like kidney, heart, lung, brain. And then the non-vital organs like skin, hair, nails, they start to have less nutrition. And that is one of the main reasons. So the hair goes into the resting phase. It starts to think, well, now I need to rest. I shouldn't grow. And that's the reason for hair loss. The second reason, and it's a characteristic of this phase of resting phase, is nutritional deficiency. So there's significant nutrition deficiency when people lose a lot of weight. And what are they? It's iron, protein, biotin, B12, zinc, and essential fatty acid, and then selenium as well. So whenever there's deficiency of these vitamins and minerals and essential amino fatty acids, you can lose hair. And then the third one, which I see as an endocrinologist, is hormonal changes. People don't appreciate this. Whenever you lose weight, your hormones also changes. And what are the hormones commonly which changes? Thyroid, testosterone, insulin, estrogen. All these hormones also changes. For example, let's say there's a 100-kilogram person. And suddenly they drop down to 60 kilogram in a matter of 4 or 5 months. So that's a massive weight loss. So your body also will require less thyroxine. But if it doesn't adjust, there may be an inadvertently more thyroxine, especially if someone has underactive thyroid and they're on thyroxine. When you lose weight, you need less thyroxine. But if you don't change it, and if you're still on the higher dose of thyroxine, you can lose a lot of hair. So your body gets into an overactive thyroid state. From an underactive, it can become overactive. That's why it's always important to be under a doctor. So I'm always concerned about people who buy these medications on the net or from a pharmacist and are not monitored by a doctor. You should always have a doctor and you should be under the care of a doctor when you're on these medications. And the last and the most important bit during the telogen phase is metabolic stress. So any metabolic stress, not just weight loss, any metabolic stress will trigger the hair to get into the telogen phase. So I've talked about too much of the telogen. Let's get into the details. So what is a normal hair growth cycle? Just like human beings move from infancy to childhood to teenage and then the reproductive age and then the old age. So that's the growth cycle for a normal human being. And similarly, hair also grows through similar sort of stages. So the first is the anagen or the growth phase, the catagen or the transition phase, and then telogen or the resting phase. So in a typical person, a healthy person, 85 to 90% of your hair is in the anagen phase or the growth phase. That's why when you go to the hairdresser, you have your hair cut, in another couple of weeks' time, you find that your hair has grown. That's because most of your hair is in the anagen phase. So up to 90% is in the anagen phase or the growth phase. 1 to 2% is in the catagen phase, which is the transition phase. Here the hair stops growing and the follicles shrink, but that's just 2% of your hair. And then the telogen phase, which I was talking to you about, which is the resting phase, and it lasts for 2 to 4 months. Here the hair remains in the follicle but doesn't grow. In any healthy person, 10 to 15% of your hair is in the telogen phase. You can recap. So the growth phase is 85 to 90%. The transition phase or catagen phase is 2%. And the telogen phase is 10 to 15%. Whereas in people who are under significant stress, those who lose a lot of weight, those who have nutritional deficiency, there's a lot of stress, suddenly the telogen phase from 10 to 15% can become 30%. So that means 30% of your hair follicles are under a resting phase. So what happens is you may have diffuse hair loss. You may find that when you comb your hair, there may be clumps of hair coming out. Or when you get up in the morning, you may find clumps of hair on the pillow, or you may find clumps of hair on the drain following a shower. So that's usually classically what my patients complain of when they're in the telogen phase. So now you understood what is telogen effluvium. So it can be sudden or it can be chronic. So it can be acute or it can be chronic. It can happen for a few months or it can drag on. And it usually drags on when you don't seek help and you continue to be in this state of constant stress. You continue to lose weight. You are nutrition deficient. So the telogen phase is prolonged. But the good thing about the whole hair loss, especially with GLP-1s, is it's reversible. It can be corrected. But it takes from 6 to 12 months for it to be completely corrected. Okay, so I've talked to you about the mechanism of action. So what would you do? What's the treatment options, especially when you have hair loss? As I said, it is due to nutrition deficiency. So protein supplementation is very important. This is why I always recommend my patients to seek advice from a dietitian. So how much protein do you need? You need at least 1 gram for every kilogram of body weight. So let us say you are on a weight loss journey. You need to have adequate protein supplementation. So how much protein do you need? You need 1 gram per kg body weight. So let us say you're 100 kilograms in weight. So you need 100 grams of protein. This is why it's very important to seek advice from your dietitian and have adequate protein. And then what supplements should we have? I usually recommend biotin, iron, B complex, and vitamin D. That's very important. In addition, you need zinc and selenium. So there are 6 important ones. Biotin, iron, B complex, vitamin D, zinc and selenium. But please do not take this without consulting your doctor. Now, let's say you are adequately replaced with protein. You have all the supplements. And despite that, you're having excessive hair loss. That's worrying. And it can affect your self-esteem and confidence. You should seek help from your doctor, specifically a dermatologist. And they usually recommend minoxidil or some peptides. And if it's quite bad, you may even be recommended to have low-level laser therapy, PRP. I'm not in favor of that. And some of my patients, I know they have seen dermatologists and they've been on finasteride. The men have been on finasteride. The women have been on spironolactone or even oral minoxidil. I'm dead against this. That's my personal opinion because I've seen men who are on finasteride having significant problems with erection. They have erectile dysfunction and sometimes it's even irreversible. So I personally do not recommend finasteride. I actually would prevent hair loss rather than getting into this complication of finasteride. You may have another new problem. It's very important to use the right shampoo and make sure you look after your scalp, a regular massage. Now, coming to the most important bit, which I'm keen about, is prevention. The most important thing is prevention. You don't want treatment of hair loss. Sometimes it can be quite significant. So when you start medications, especially Mounjaro and Wegovy, please make sure you consult your doctor. And if you are having nutrition deficiency, you should have proper supplementation. So let's say you have hair loss, you should see a doctor and get blood test. full blood count or complete blood count, ferritin, transferrin saturation, vitamin B12, folate, vitamin D, thyroid function test, zinc and selenium. These are the common ones I usually recommend when someone comes to me for hair loss. And then I recommend vitamins, zinc, selenium, irrespective of whether they are having hair loss or not. I usually advise my patients to have these. And it's always good, especially if you are losing significant amount of weight, you should see your doctor and get regular blood test. So when should you seek help? You should seek help when there is sudden severe hair loss, or if there is patchy symmetrical hair loss, or if there's excessive irritation and pain, or if there's persistent hair loss for more than 6 months, even though your weight is stable. So in these conditions, please seek urgent help from your doctor. I also recommend seeing a psychologist or psychotherapist, because this can have a significant impact on your mental health if the hair loss is quite profound. Well, let me conclude to say that it's a potential and distressing side effect, especially those who are on Wegovy and Mounjaro. 3 to 6% of patients can get affected. But you need to understand that benefits of Wegovy and Mounjaro outweigh the side effects. So you would want to carry on with Mounjaro and Wegovy. So the trick is early identification, prevention, and finally treatment. For that, you should be under the care of a doctor. But don't worry, as I said, the good news is it's a reversible condition and most people recover from it, but the recovery takes from 6 to 12 months. Hope I've answered most of the questions related to hair loss, Wegovy and Mounjaro. I'll be talking to you about more serious complications with this class of medications. If you have any questions, please do put that in the comment box. I would be happy to answer. But the most important thing is it's an educational video and I'm not giving any personal advice. So please always see your doctor for more personalized advice. Bye for now.